Hi, everybody. My name's Nikki with Plan A, and I'm here with Murray, James, and Sarah. And today we're going to be talking about anxiety and panic attacks as part of our mini series for Bell Let's Talk. All the information today will be linked down below, as well as support numbers to call if you feel in distress with any of the topics as discussed. This topic is near and dear to my heart as I have personally suffered from anxiety disorder and have suffered because I didn't know a lot of the information that we're going to discuss today. I'm happy that these resources are made openly available today. Anxiety is one of the most commonly diagnosed mental conditions in the world, and there are many varieties: social anxiety, generalized anxiety, panic disorders, and many others. Furthermore, tons of other mental health issues like PTSD and depression can often cause anxiety.
Regardless of how many different types and causes of anxiety there are a few signs and symptoms that you may be suffering from something more than just a passing wave of anxiety. We've all experienced fluttering hearts, nervous spikes that occur when we have to do something we're not comfortable with. The story in my family is always when I was younger, I had terrible stage fright. My parents took me to a school play that I was supposed to be in, and my dad will always tell you the story of saying to the parent next to him, "Who's your child?" "That's my one." And the guy says to my dad, "Who's your child?" And he says he's the one spewing over all of the front row. That was always me. I had terrible stage fright and I would throw up any single time I had anything. We've all felt anxiety at some point in some way or another. Um, these symptoms often arrive persistently in people who actually have a problem with anxiety. If you experience any of these symptoms on a regular basis, then you might want to consider seeking medical attention for proper diagnosis and discuss possible treatment options.
So, the first symptom that we will discuss is fixation on the future. Anxiety is a condition that is marked by fixation on the future. It simply doesn't exist unless you are, at some level, focused on the future. This is because anxiety is a condition that occurs when you consciously or unconsciously are worried about what could happen. For this reason, sometimes anxiety is referred to as the what if disease. That's because someone with anxiety is always worried about what might go wrong. Approaching a big group of people, what if you stumble and make a fool of yourself? Going to give a speech, what if you forget the words? These are all forms of anxiety that arise when you are worried about what could go wrong. This distracts you from functioning at your highest level because you end up worrying so much about what could happen, you neglect to pay attention to what you are doing.
Very true, Sarah. Another symptom to keep an eye on is restlessness. While this doesn't necessarily indicate panic, it's also one of the biggest telltale signs of someone who is experiencing an anxiety attack. If you ever find yourself fidgeting, shaking your leg, or otherwise unable to keep still, especially when you're not necessarily full of energy, then it could be a sign that you're trying to distract yourself from the way you've been feeling.
Another symptom is difficulty concentrating. It can be immensely difficult for someone suffering from anxiety to be able to concentrate on anything. This is because anxiety has a tendency to overwhelm a person's train of thought. When you're constantly worried about your surroundings, the future, or the things in your life, it becomes a loop.
Anxiety can also manifest itself in physical ways as well, with our next symptom that we're going to touch on being nausea and vomiting. It's normal to become anxious when you have an important moment in your life presenting itself in front of you. Usually for most of us, this feeling goes away when we're able to perform as intended. For patients suffering from anxiety disorder, the anxiety is too much to tolerate and can cause symptoms that prevent the patient from functioning. Nausea and even vomiting are quite common symptoms for patients dealing with an anxiety disorder. If you think you might be suffering from an anxiety disorder, it's important to get help from a professional to diagnose and treat the condition.
One thing that I think some people have felt with is another one of these symptoms, which is a fear of dying. I know my brother has had anxiety attacks about this particular thing before, and it's quite normal for anyone to fear their own demise, but generally it's not a regular thought in our minds during an everyday situation. For patients suffering from anxiety disorders, especially the ones with panic disorder, the fear of death is constant. The thought of imminent danger can come at any moment, causing the patient to drop everything they're doing and focus on their irrational fears.
Another symptom is muscle tension. Anxiety can cause tension to build up in your muscles. The constant state of distress can result in muscle spasms and tightening of certain groups of muscles, especially in the neck and back. This can also lead to aches and pains all throughout the body. This might become more apparent during a stressful situation, but it can get to the point where this pain and tension is present at all times.
Absolutely, Sarah. Another thing to keep in mind is that you may be sweating more than usual when you're suffering from anxiety. This is another physical symptom that emerges quite frequently in people who are suffering from anxiety and panic. Sweating is pretty natural when someone exerts themselves physically, but it can also occur as a sign of anxiety. It's important to notice that this symptom can also be caused by many other conditions, such as hyperhidrosis. If you're suffering from this symptom, again, seek medical attention for a proper diagnosis.
Another symptom can be shortness of breath or hyperventilation. These are classic symptoms of a panic attack. The patient usually finds it difficult to breathe without any reason to justify the symptom. Hyperventilation is also quite common, and it may cause the patient to lose consciousness. During a panic attack, it is helpful to breathe into a paper bag to prevent a fainting episode. If you're suffering from panic attacks, you should book a consultation with a physician to properly diagnose your condition.
One thing that you might suffer with if you have an anxiety disorder is insomnia. People who have anxiety have a hard time getting to sleep, especially when their anxiety is flaring up when it's near bedtime. Racing thoughts are a trademark of anxiety, and they're also a trademark of people who have a hard time falling asleep. Anxiety can also manifest itself as emotional turmoil. Your feelings might simply be too much for you to be able to fall asleep with them. This is especially apparent if a person has something coming up, like an appointment or a speech, or if something stressful has happened.
Another very common symptom is irrational fears. So, one of the basic things about anxiety is that it's a worry about something that hasn't happened yet. There is also a lot of irrational fears that can emerge when someone is anxious. That can be very specific or very broad. For example, they may fear getting hit by a car every time they cross a sidewalk, which is extremely unlikely. Fears like this can have a negative impact on a person's lifestyle and can be severely limiting. Irrational fears can prevent someone from enjoying themselves socially, from getting out of the house, or for succeeding in the area that they wish to.
Absolutely, Sarah. Next, we want to touch on panic attacks, as these do relate closely to anxiety and can often be triggered by some of the same symptoms as an anxious situation or episode. Panic attacks obviously come on suddenly and involve intense and overwhelming fear. They're accompanied by frightening physical symptoms such as a racing heartbeat, shortness of breath, or nausea. Unexpected panic attacks occur without obvious cause. Expected panic attacks are cued by external stressors such as the individual's phobias that they may be experiencing. Panic attacks can happen to anyone, but having more than one may be a sign of a panic disorder.
So what's the difference really between anxiety and a panic attack? Well, anxiety is typically related to something that's perceived as stressful or threatening. Panic attacks, they're not always cued by stresses. Quite often they just occur out of the blue.
Anxiety can be mild, moderate, or severe. For example, anxiety may be happening in the back of your mind as you go about your day-to-day activities. Panic attacks, on the other hand, mostly involve severe disruptive symptoms.
During a panic attack, the body's autonomous flight or fight response takes over. Physical symptoms are often more intense than symptoms of anxiety. While anxiety can build gradually, panic attacks usually come on abruptly.
Panic attacks typically trigger worries or fears related to having another attack. This may have an effect on your behavior, leading you to avoid places or situations where you think you may be at risk of suffering a panic attack.
Unexpected panic attacks have no clear external triggers. Expected panic attacks and anxiety can be triggered by similar things. Some common triggers include a stressful job, driving, social situations, phobias such as agoraphobia, fear of crowded or open spaces, claustrophobia, fear of small spaces, and acrophobia, fear of heights. Reminders or memories of traumatic experiences, chronic illnesses such as heart disease, diabetes, IBS, or asthma. Chronic pain, withdrawal from drugs or alcohol, caffeine, medication and supplements, or thyroid problems.
Anxiety and panic attacks have similar risk factors. These include experiencing trauma or witnessing traumatic events, either as a child or as an adult, experiencing a stressful life event, such as the death of a loved one or a divorce, experiencing ongoing stress and worries, such as work responsibilities, conflict in your family, or financial woes, living with a chronic health condition or life-threatening illness, having an anxious personality, having another mental health disorder, such as depression, having a close family member who also has anxiety or panic disorders, or the use of drug and alcohol. People who experience anxiety are at an increased risk of experiencing panic attacks. However, having anxiety doesn't mean you will experience a panic attack.
If you feel an anxiety or panic attack coming on, try the following. Take slow, deep breaths. When you feel your breath quickening, focus your attention on each inhale and exhale. Feel your stomach fill with air as you inhale. Count down from 4 as you exhale. Repeat until your breathing slows. Recognize and accept what you're experiencing. If you've already experienced an anxiety attack or panic attack, you know it can be incredibly frightening. Remind yourself that the symptoms will pass and you'll be all right. Practice mindfulness. Mindfulness-based interventions are increasingly used to treat anxiety and panic disorders. Mindfulness is a technique that can help you ground your thoughts in the present. You can practice mindfulness by actively observing your thoughts and sensations without reacting to them. Use relaxation techniques. Relaxation techniques include guided imagery, aromatherapy, and muscle relaxation. If you're experiencing symptoms of anxiety or a panic attack, try doing things that you find relaxing. Close your eyes, take a bath, or use lavender, which has relaxing effects.
Making changes in your lifestyle can also help you prevent anxiety and panic attacks, as well as reduce the severity of symptoms when an attack occurs. Things like reducing and managing sources of stress in your life, learning how to identify and stop negative thoughts, get regular, moderate exercise. You can practice meditation or yoga. You can also eat a balanced diet or join a support group for people with anxiety or panic attacks. And also limit your consumption of alcohol, drugs, and caffeine.
Speak to your doctor about other treatments for anxiety and panic attacks. Some common treatments include psychotherapy or medication, including antidepressants, anti anxiety drugs, benzodiazepines, basically tranquilizers such as Valium. Oftentimes, your doctor will recommend a combination of treatments. You may also need to alter your treatment plan over time. This concludes our conversation on anxiety and panic attacks. Thanks for listening, everyone, and I hope you learned about the topic. And stay tuned to our future podcasts and make sure to follow us on all our social medias.